with the RCC. I think that way things will move because we'll be able to communicate regularly and some of the activities properly brought to the attention of the member states. And then it's the issue of the working groups. I think we set up a number 6 of them, those working groups, based on the various thematic pillars. And again, these haven't been able to function fully. And I'm sure my colleague who's taken up the responsibility, I think is one of the key things which will make us move in the various pillars. And then the other issue I just want to say is the encouragement for the member states to ensure establishment of a dedicated technical wing responsible for health security, whether it's a National Public Health Institute or CDC. And there's a lot we can learn within our region at different stages. Of course, the senior most, where my chair is coming from, Mozambique, there's quite a lot we can engage and move this agenda, because once we have a technical wing, it is going to link us all in the region, and we have quite a lot to share. And lastly, is investing also in our capacity building. We can have vetted, trained the response or surveillance or the laboratory. We'll be creating assets for our region. So I thought I'd bring a bit of those dimensions, much as we look at the governance structure, but also ensure that we are supported in terms of operational issues. Over to you.
Thank you so much, Victor. That's very helpful insight, and your experience and hard work in getting the RCC going in the last few years has been invaluable. So if I hear you well, in order to get the RCC moving, we need to, in addition to the governance structures, also work on some operational issues that both at headquarters level in Addis, but also at the level of member states that need to be better engaged in the operations of the RCC. If I can come back to my previous question to the coordinator of the RCC on how we can get the technical advisory committee to function more regularly, because many of these issues that our friend Victor has mentioned should be also discussed at the level of the technical advisory committee. Dr. Lowe?
Can you hear me?
Yes.
Yes, thank you, Chair. And also I would like to seize the opportunity to thank Professor Mutukwa for providing updated information in terms of the formation of the Technical Advisory Committee. Indeed, the Southern Africa RCC in this meeting is proposing, in consultation with South Africa, which is the chair of the Regional Technical Advisory Committee, to convene a meeting of the Regional Technical Advisory Committee within 2 months. So we will do that consultation immediately with the permission of the meetings. Once we confirm it with the chair of the Technical Advisory Committee, Southern Africa RCC will move as quickly as possible to develop the concept note and objective and the other process. If the situation is not going to allow, we will propose a virtual meetings. If situations allow, we can have a personal meeting, because it's such an important structure in governing of the Southern Africa Regional Collaborating Center. Over to you, Chair.
Thank you very much. It sounds, I think, reasonable to have the first meeting within 2 months, and it will be good, I think, also to have a schedule of meetings for the rest of the year in a regular fashion that would allow the technical advisory committee to function and to some extent this is the technical soul of the RCC. It's an important committee. So what would be, if I can pose the next question on what will be the timeline that we could adopt to have the steering committee meeting for the first time. Wanted to hear from you, your opinion. Can we start with our colleagues at the Africa CDC headquarters? Perhaps Dr. John Kangasong?
Maybe let me defer that to Justin and respond to the question that Professor Victor Mukonka raised. I think Justin is working closely with the regional coordinator on that question. So I think it is a priority, Victor, that because you now have a resident coordinator, that specific budgets will be allocated for the regional collaborating centers. That way they can plan the activities appropriately and then execute them. And we don't need to go through those planning and defaulting as it was before. I think mainly it was driven by the fact that there was really no permanent resident in place. I think you'll begin to see changes in the coming weeks or coming months once we have that their regular budgeting arranged. So, Justin, you want to respond to Elish's question?
Thank you, Director, and I'll be glad to add into what you have already alluded, and to say that we're working tirelessly as now we have the resident coordinator in the RCC itself to have a very stable mechanism for having funds that can help run all this in a very flexible manner that will allow such timeline that would be set within the region to prosper without any interruption. That's number one. Number two, I think the timeline for the RCC Technical Advisory Committee will be agreed within the region, and will not like as the headquarters to dictate that, because this will be depending on the priorities within the regions and how frequent they want to meet, as well as how timing of different events that are happening within the region. But just to highlight also one of the key issues that will be needed, that at least at the end of each year before the beginning of the next financial year, as Africa Union financial year starts mostly from January to December, at the end of each year, there must be at least one advisory technical committee that has to sit and look on the priorities within the region so that they can be incorporated into the overall Africa CDC planning and budgeting that will be submitted to the African Union policy organs for approval. So within that time, it's when we need to ensure that this happens, and then from the results of this technical advisory committee and the strategies and priorities within the region, it can be also pushed over to the steering committee for the endorsement, and then being submitted as a draft to the Africa CDC headquarters to be combined with the overall Africa CDC plans and budgeting that will now go through the policy organs of the union for approval and getting some resource allocation. So I hope that responds to your question.
Justin, can I please just ask your opinion on the steering committee? How long do you think it will take us to operationalize the steering committee? Do you have any comment on that? How, I mean, in order to organize a meeting of the steering committee this year, when do you think will be reasonable to expect the first meeting to happen of the steering committee?
Thank you, Lani. I think that's a very, very crucial question. And as earlier, that we have that the RCC framework that has been developed, and that also we have a draft that also be going in any next convening, but now the draft can be operationalized within the region. That defines and provide an overall framework on how business should be run within the region and also be adopted by each region. As the Africa CDC Secretariat Headquarters, we will not want to dictate on how that would be. It has to be still under the decision of the region itself to see when they can do that based on the framework and the guide that we're trying to provide, at least to harmonize across different RCC, different regions. So that has to be decided within the region. And this is where we need to agree upon on how frequently and how often do we, how quick and do we think that the steering committee can sit, and who should be constituting the members of the steering committee beyond the ministers of health. I think following that same framework. So I will not have a direct answer that this is when we want it to be, but following that guidance, this has to be made, the decision has to be made within the region. Over.
All right. Okay. Thank you so much. Our time is coming to an end, so I will just rapidly conclude the session. Yes.
This is Ahmed, Deputy Director at Africa CDC. Can I add one item?
Yes, please. Go ahead, Ahmed.
Yes, I think we want to challenge the region now that the RCC has been launched in as far as the steering committee is concerned. Africa CDC, we will make available the resources for a meeting, and we want to challenge the region to hold one before the first half of this year. When an agreement has been made on the dates, we will facilitate that before the end of June 2021. We will be prepared to facilitate that in the first half of the year for the first meeting of the steering committee. Thank you.
Thank you very much, Ahmed, and thank you for challenging us. This is good. We work together to make this happen. So if I can just quickly summarize what we have achieved in this discussion, we'll aim at organizing a meeting of the technical advisory group within 2 months, and to have a schedule of meetings for the rest of the year. We'll work on structuring the steering committee according to the guidelines from the headquarters of Africa CDC, and work together on figuring out how this will also interact with the other regional structures. Third, now that we have a resident coordinator, we'll have the operations will be more flexible and stable, and the various activities of the RCC should pick up faster now. And finally, that some challenges remain both at the RCC level, but also at the level of member states. And we have captured a number of these challenges that remain, and that we count on the support of the headquarters of Africa CDC to get the RCC moving to the next level. So with that, I thank you for your attention and for this discussion, and I hand back to our colleagues in Zambia. Thank you.
So thank you very much. We move to the next session, which I'm privileged to chair. This is Victor Mukonka, the Director General for the Zambia National Public Health Institute. So we're going to focus a little bit the next few minutes on the strengthening in terms of cooperation and partnerships amongst the Southern Africa member states and the health partners. And to help us discuss this, let's engage with the various partners we have lined up here, both from a UN family, some of the bilateral, and some of the well-known institutions. I will be inviting 3 speakers basically, and just giving you 3 minutes, and then we engage the partners. So the first speaker, we have 3 minutes, is our coordinator for the Southern Africa Regional Collaborating Center. And this is Dr. Luke. I'll give you 3 minutes on this subject to make your statement. And then, of course, we engage the various partners whom we have on the platform here. We have Dr. Pascale Ondoa, who is the Director of Science and the New Initiative from ASLIM. We also have Dr. Simon Agori, who is the US CDC Country Director for Zambia. Then we have Dr. Nathan, who is our WHO Country Representative. And then we have Miss Noala Skima, who is the UNICEF Country Representative. We have Joseph Pett, who is a Senior Health Advisor for Public Health England. We have Mr. Sarah from World Bank, Country Manager for Zambia. And then, of course, the Southern Africa Development Community, SADC and COMESA. So let me start with our RCC coordinator to make your statement.
Yeah, the first question will be asked by my colleague, Dr. Mohammed. Dr. Mohammed, over to you, please.
Thank you very much, Dr. Lu. 2 weeks ago, an Africa CDC report was released from a regional assessment that was conducted by World Bank and ASLM in Southern Africa RCC, precisely Zambia, South Africa, Zimbabwe, Malawi, and Mozambique, on strengthening disease surveillance, emergency response capabilities, and laboratory networks. Dr. Pascal Onda, the Director of Science and New Initiative of the Africa Society for Laboratory Medicine, ASLM, will be taking us through the findings, the opportunities, and recommendations of the study. So let me hand over to Dr. Pascal to enlighten this August gathering on the findings, opportunities, and recommendations of the study. Over to you, Dr. Pascal.
Thank you, Dr. Mohammed, and good morning, everyone. So yes, that was really, we are thankful to the World Bank to have given the opportunity of ASLM to partner with IQVIA to do this study. So I have 3 minutes to walk you through the findings, and so let me just get through the pillars that we had analyzed: the ReselNet, the laboratory network, the surveillance, and the emergency operation centers. So in a nutshell, the strengths that we had identified for the ReselNet was really what I heard being discussed right now: the large agreement on ReselNet by the member states, and of course the gaps which are about the funding, and until now the lack of governance framework for the ReselNet. For the laboratory network, we identified that there was really some capacity in place to test for some priority diseases in some countries. So there are hubs of capacity in the region that can be used to cascade down this capacity across more widely. There are some important framework that are in place, especially in terms of quality of laboratory or biosafety that can be used to move forward. However, we find that there were some unclear mandates for national public health institutes and fragmented implementation of essential diagnostic tests. For the surveillance, we identified that there are some systems and activity in place for some surveillance, like for example, the AMR surveillance that can be used to be cascaded down. And we find some instances where there is some cross-border data sharing, which was very important. And for the emergency operation centers, we find that some of them are functioning well. And we saw as well for the COVID-19 response that there's been a regional coordination through the African CDC, but that this would need to be better coordinated. So in terms of recommendation, if I start with the RiselNet, so with the previous conversation that just happened, we identified that there is an opportunity for the regional collaborating center to play a more consolidated role with coordinating, some of the activity in the region and have the National Public Health Institute implement those activities. So having a framework and an understanding on how should that be moving forward with some structured funding was the main recommendation. So still on the RiselNet, we suggested that the National Public Health Institute could be taking the lead in making sure that the workforce at the National Public Health Institute and laboratory has sufficient competencies and that they could develop staffing norms and make sure that the training is being done and that the competencies are being tracked and updated for very important surveillance functions. Moving to the laboratory network, one of our recommendations was to really pay attention at country level, the function and the capacity of the tier network, because the thinking is that it is only when the tier network is functioning and that the clinical testing is being done adequately that then a surveillance system that is relevant and that is strong can actually take place at the regional level. We also recommended that the quality management system and the biosafety are really very important entry point to strengthen the whole system for testing and also for surveillance. And that would help really to have a quality disease surveillance system in the region. Under the pillar of surveillance, so the region already has some powerful guidelines under the IDSR and the AMR surveillance with a lot of recommendations that are provided by the WHO. So our recommendation is really to strengthen these and to reinforce the consolidation of the priority disease list so that the surveillance can really be anchored on a few priority diseases that are corresponding to the disease burden in the region. We recommended to improve the overall use of electronic information system to really improve the volume and the quality of data that are reported for the surveillance, and also to reinforce the sample referral between countries, so cross-border, and some examples are already happening, and we think that, for example, the regional collaborating centers could have a role in really making sure that SOPs are in place and that public-private partnership are being brought on board to support the sample referral system between countries. So finally, for the emergency operation centers, we identified that Ethiopia, for example, and Uganda have nice, they have those in place that are working, and they have developed some multi-sectoral plans for emergency. So the model could be applied to other countries in the region. And we identified that the AVOC initiatives from Africa CDC could be turned, those members could be which could be the one participating to the response team during outbreak response. That could be, for example, coordinating by the RCC and serve the countries coordinated by regional, the regional collaborating centers. So in a nutshell, and I hope that I didn't pass my 3 minutes, these are the highlights of the recommendation. Of course, there were more, but this is a starting point for the discussion. Thank you very much.
Thank you so much, Dr. Pascal, for highlighting the key findings, the opportunities, and some of the key recommendations. So next, I will follow up with Africans, with the country director, US country director to Zambia. As you know, Africa CDC is committed to support Zambia National Public Health Institute, not only to be able to deliver the minimum, but to be the model for the regions. But based on those challenges that were presented, Zambia National Public Health has to overcome some challenges. So we would like to know how the US CDC country office can work with other health partners to complement one another to support the ZNPHR. So over to you, Dr. Simon Taglori, the country director for US CDC to Zambia. Over to you.